Okay, this is again week 2. We're talking about skeletal system in this one, and I have here. This is a workbook that I made up for my other classes. You can see there's lots and lots of questions on here, and nothing that you guys need to do for Fortis. But I want to go over this one little picture right here. And the reason I want to go over this one is because it has some important concepts. There's some places on the skull. This is really simple and really easy that I'm not sure is really mentioned, but I wanted to add it anyway because some of the things we need to know. Now, the skeletal system is an entire system. Every bone is an organ in that, right? 206 bones in the adult human, 300 in the baby. Did you know that babies don't have kneecaps? Well, now you do, right? So this is the top of the skull right through here. And as we come over to this side here, we look at this guy. I don't know why it doesn't have my cool thing is gone. My changed my cursor, man. Anyway, top of the skull. This is the frontal bone, right? That's right here. This is the parietal bones. Parietal means the same word in Spanish as pared, which means walls on the sides, and in the back is the occipital bone. It doesn't even show that down here, but there's the occipital bone. The occipital is in the back, and some people have a bump back there. It's called the bump of knowledge, or the epistrophe. Not the epistrophius. It's called the uh, can't remember what it's called, but I'll remember later. Oh, protuberance, whatever. Occipital protuberance. Anyway, bump of knowledge is what it's called. This squiggly line through here is called a suture. Suture is where they meet together, like suturing, sewing, right? It meets together. This area of the skull can actually move this way. Not a bunch. It's not like it goes like this or something, but when you breathe, it actually can change. We know that now. This one in the front here is called the coronal suture or the frontal suture, and it's right on the top. This guy right through here, right through there, as you can see on the picture, that's called the bregma, and that's the soft spot for babies. Now, when a baby's crying really a lot, you just press on that and hard enough, and they stop crying. Don't do that, actually. I'm just kidding. That's teasing. Don't do that. It's a soft spot that actually closes, and the reason it's a soft spot, the bregma is open, is because the baby's head has to collapse and close to get through the vaginal canal. Along this one here, this is called the, like I said, the sagittal, mid-sagittal suture, and in the back here, this one's called the lambda. This is the bregma right here in the top, and then the lambda at the back, lambdoidal suture right here, the occipital parietal suture, right? So that's it. That's all I wanted to go over for those. As we go down through the skull a little bit, we have a lot of different things. Now, here's that. There's the frontal bone, right? There's frontal bone. There's the parietal bone back. There's the occipital bone in green. There's the temporal bone, and this one's called the sphenoid bone that goes all the way through the entire skull. And this is called the zygomaticus. One of my favorite words, actually, is zygomaticus. And then we have the maxilla through here, and the mandible, maxilla, mandible, maxilla, mandible. And then this guy through here is got the nasal bones, right? So you can see those. Other things too, mandible is sometimes not considered part of the face. I don't know why, but many places will count the bones and they won't include this, which hold the lower teeth. Um, Check out teeth, like 20, was it 20 teeth in kids and 32 in adults? Can't remember if it's actually that. I'd have to look it up, but I know there's different. You have molars and you have bicuspids and tricuspids, and then you have incisors and you have incisors and canines, and then bicuspids and tricuspids, molars. Different kinds of bones for, or different kinds of teeth for doing different kinds of things. One of the weird things about teeth is teeth don't naturally have fluoride in them. What they actually have is what's called hydroxyapatite, which has a lot of phosphorus and a lot of calcium in it. So, um, fluoride actually is just a very cheap and easy, attractable by chemistry. It attracts very easy to those cavities or those little acid parts that are breaking apart, and it fills them up nicely, although it can crack. So anyway, just wanted to go through about 4 minutes of skeletal real quick as we come down here. I'm not going to let you do this or have you guys do this. There we go. There's all these little bones, and I'm going to do them all in about 1 minute. So we have the cranial bones up through here, and then there's the nasal bone. That's the mandible. Then we have this is the clavicle right here, the humerus on the side, and the back of it is called the scapula. Down the middle, this one's called the manubrium, and this is the angle of Louis. And then you have the sternum, and then at the bottom of the sternum, the xiphoid process. You have 3 different kinds of ribs. There's 24 total ribs, 12 pairs. First 5 are called true ribs because they're attached directly to the sternum, and the next 6 through 10 is attached to this cartilage in the bottom, and those are called false ribs. And then the last 2 in the back, right over the kidneys, are called the floating ribs. You have 7 bones in the neck. Those are called the cervical vertebra. 12 in the thoracic, which are attached to the ribs. That's called the thoracic spine. And then 5 in the lumbar, which can vary in some people. Now, the sacrum is the base down here where we have the pelvis. The pelvis is made up of 3 parts: the ilium on the top, the ischium on the bottom, and the pubis in the front. And that attaches in the acetabulum, which is the hip joint, into the uh, femur, which goes all the way down to the kneecap, which is the patella, and that's a floating bone. And then you have the shin bone in the front, which is called the tibia, and the one on the outside is called the fibula. And then we have these guys down here, the tarsal bones, because you walk on tar, it's easy to remember. And metatarsals is the top of the foot, and then phalanges, which are phalanges here and phalanges on your feet, doesn't really matter. Go out to the arm, and we have the humerus on this side, which makes to the elbow, the shoulder to the humerus is the 2 bones that connect. Up here is the acromion joint is up here, and clavicle and scapula. And then down here in the elbow, this part here, which goes all the way to the pinky side, is called the ulna. And the one on the thumb side, which rotates on the outside, is called the radius. So thumb side radius, rad. And pinky, I don't know, elbow, whatever. Venus, I don't know, whatever. Carpals, because you drive a car, right? And then you have metacarpals, which are 5 of those. And then you have phalanges. There are 14 bones in each hand, right? That's a lot, 14. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. And that's all the time we have. 6 minutes. Oh, I went. Sorry about that, guys, but there you go. You got your week 2 second video. Later. Bye.